My name is Leah Venard, and I'm so excited to be partnering with International Sports and Orthopedic Manual Therapy to bring you this course. I started my education at the University of South Carolina, where I got a bachelor's degree in exercise science with an emphasis in health fitness. I went on to get my master's degree from Texas Tech University, and 2 years later, I sat for my board certification to be a certified hand therapist. I love teaching people how to treat the hand because I think a lot of people think it's trickier than it is, but we'll go over surface anatomy, different kind of tests, and then different treatment techniques to gain your confidence so that you can bring this ethical and evidence-based practice to a worldwide population. Again, I'm thankful to International Sports and Orthopedic Manual Therapy for giving me this opportunity to teach you. We will begin our sessions with an overview of the surface anatomy of the flexor and extensor mechanisms of the finger. I believe that you must know your surface anatomy so you know what underlying structures are there, so you can tell, okay, a patient has pain in this area, what structures are there and what could be involved and how do we treat it. The flexor mechanism is a lot easier than the extensor mechanism, but either way, I want you to have confidence in knowing what is involved so you have confidence to treat your patients. After we review the surface anatomy, we will go into the different tests that we will be teaching. The biggest one will be palpations for trigger finger. We will do tests for radial styloid tenosynovitis of Finkelstein's, Eichhoff's, differential diagnosis that from intersection syndrome, and then a lot of the other injuries that we see can be diagnosed, yes, hands-on, but also by watching the patient move through specific movement patterns. So you will learn to enhance your observation skills when it comes to diagnosing finger injuries. Seeing as this is a manual therapy course, we will be learning how to do ORL stretches to the oblique retinacular ligament for the injury that involves. We will learn transverse friction massage to certain inflamed tendons, as well as retrograde massage to bring in healthy blood flow and to just calm the tissue down to help with pain so that the patient can be pain-free and independent again, as that's always our goal in therapy. One of my favorite things about being a certified hand therapist is all the different orthotics that I get to make, as I believe this can protect the patient but also increase function. We will learn how to make an orthotic for a mallet finger as well as for a trigger finger, and a gentle extensor support for sagittal band injuries. We will learn how to size a LMB splint for boutonniere deformity, and we will learn how to use elastomer pads and silicone pads to help break down scar tissue, in addition to the manual therapy that we're already going to be learning on how to handle these cases. I believe that splints and orthotics are a wonderful way to help get the patient back to independence as soon as possible. I'm so excited to be with you guys.